My presentation's on schizophrenia. It's case study 13 in our book. The symptoms of schizophrenia are delusions, hallucinations, disorganized speech, very abnormal motor activity, including catatonia, and negative symptoms. So for diagnosis, there has to be 2 or more symptoms for at least a month, and at least one of those symptoms has to be delusions, hallucinations, or disorganized speech. The individual must function more poorly in various aspects of life than they did prior to any symptoms, and they must continue to display at least 5 more months of impaired functioning beyond the 1 month of the intense symptoms that was required in the beginning. So potential causes. There's genetic factors, so the more closely related you are to somebody who's diagnosed with schizophrenia, the more prone you are to getting it. So somebody who's not related at all to anybody with schizophrenia is much less likely to develop schizophrenia from a stress trigger than somebody else is. There's also a 48% risk among identical twins. There's also biochemical abnormalities, which is the abnormal functioning of dopamine transmitters, which is why they use antipsychotic medications to treat schizophrenia. And then there are brain structure abnormalities. There's a lot of different types of these. There's enlarged ventricles, which could also cause the smaller temporal and frontal lobes. There's smaller amounts of cortical white and gray matter, abnormal blood flow to certain areas of the brain, and there's sometimes also abnormalities of the hippocampus, amygdala, thalamus, and other brain structures. So Jim is the guy who we were focusing on for this case study, and he had 3 different initial big symptoms, and the first was delusions. He believed he had some sort of life force in his breath, just like God, and that he could control people and things with that. He also had auditory hallucinations. He had angels telling him that he was the Messiah and that God had selected him for some holy mission. That's why he gave him this power. And then he suffered from abolition as well. He refused to leave his room most of the time because of paranoia. He was constantly thinking that people were staring at him and talking about him, and that some evil person was going to come and try to steal his powers to use it for evil. So he was originally diagnosed with schizophrenia once his parents found out that he was going through all this stuff. They took him down to the mental hospital, and he was initially treated with thorazine. And some of his symptoms slightly improved, but many still persisted, so he stopped taking the medication. And he ended up going through this cycle of being hospitalized and taking medication, and then quitting it, and over and over and over again throughout the next 10 years. So his parents heard about this doctor called Dr. Sorkin, who has apparently had extreme success with those with schizophrenia, even those who have been treated previously for long periods of time. He believed in the diathesis stress model, which many others did as well, and this is that certain individuals have a predisposing vulnerability to schizophrenia, but the risk of developing the disorder is affected by the degree of stress in their environment. So some people have higher or lower levels of the diathesis, which is the predisposing vulnerability, and some have none at all. So the level of the diathesis determines how at risk you are for developing schizophrenia with differing levels of stress. So if you didn't have any diathesis history, then no matter how much stress you are presented with, you'll never, ever develop schizophrenia. So Dr. Sorkin decided to use a behavioral therapy called biobehavioral therapy, and here you introduce protected factors that will lessen the effects of stress or the vulnerability to schizophrenia. Sometimes there's a combination of different therapies that you use within this, such as medications, group therapies, case management, and other things, just to treat different symptoms that are present. So there's 2 different types of drugs that are usually used as treatment for schizophrenia, and the first are the neuroleptic or conventional antipsychotics, which reduce symptoms by blocking the D1 dopamine receptors. They produce undesired movements similar to symptoms of neurological diseases usually. So they came up with atypical antipsychotics. These reduce symptoms by blocking the D1, D4, and serotonin receptors rather than the D1. Well, I think I meant to put D3 there. They're also more effective and efficient. There's no neuroleptic symptoms. And so Dr. Sorkin prescribed Jim Risperdal, which is an atypical antipsychotic. So Dr. Sorkin decided to put Jim through a psychosocial skills training program, and here he learned 6 important things during his training program. He learned that medications do not work unless you take them regularly, that he could collaborate with psychiatrists to find medications that work for him. He learned how to identify the signs of relapsing back into schizophrenia. And he learned that he must intervene as soon as he sees signs of relapse instead of just letting it go for a while, because the longer you wait, the harder it is to recover. He learned how to cope with psychotic symptoms that have yet to disappear despite taking medications. And he also learned that alcohol and drugs intensify the symptoms of schizophrenia, so he must avoid those as well. Which was contrary to what he thought, because he was smoking a lot of marijuana and thought that that was helping his symptoms because it was slowing his breathing, and his breathing being slowed down was preventing him from being able to do the breath powers that he had. So they've come up with 2 long-term priorities for Jim, and it was to improve the relationship with his family and to develop an ability to function independently. They pulled his family into the rehabilitation process because Dr. Sorkin realized that there was high levels of expressive emotion that needed to be addressed within his family. They came up with 3 different communication skills that needed to be worked on, and they needed to acknowledge positive actions in others rather than just focusing on the negative things that were happening. They needed to reinforce the positive things. They needed to make positive requests of others. So instead of saying, wow, your room's so dirty, why do you let it get like this? They would say, hey, please clean your room, or please bring your laundry to me, instead of complaining about how dirty the room was. And then they would express negative feelings constructively. So instead of saying it super mean and negatively, they would instead explain why they were feeling the way they were feeling, instead of just saying that they were upsetting them. So Jim decided to enroll in a training group on personal effectiveness for successful living to help him work towards his goal of living on his own. And they taught him there how to research online for appropriate job ads, how to call or email for further information and to request an interview, how to arrive at the right time and place for the interview, and then how to go through the actual interview process. He eventually found a job he was interested in from one of his friends that was in the group. He was delivering meals to homebound elderly people, and he originally started working there as a volunteer. He was doing that for several weeks, was riding along with somebody else who was getting paid to do it, and eventually was offered a paid position there. So in the end, he decided to continue living with his parents. He did attempt to move out once, but he found that everyday tasks were extremely difficult for him. He couldn't even prepare his own meals, do all the laundry, and keep everything straight and organized. So he realized he needed his parents' help, and he moved back in with them. But he still showed significant improvement from what he was doing before, because he essentially was a hermit and was failing in his life and had no direction, and now he's doing much, much better off. And that's all. Thank you.